Going to continue discussing the hairline lowering article or surgical hairline advancement article that Dr. Epstein wrote in a recent journal in the January and February edition of the ISHRS publication. The surgical technique that Dr. Epstein uses involves a local anesthetic. I truly believe that this procedure is much safer with a twilight anesthesia, not necessarily a intubation. My patients are definitely breathing on their own and they just have an IV. But I do not agree that this procedure should be done under local anesthesia. I think my patients are much more comfortable with an IV sedation technique, and the patients have a great experience. They don't complain of any pain during the procedure. In fact, they really don't remember the procedure. And then afterwards, the recovery really is not so bad compared to what a general anesthetic would be. Most of the patients do quite well and are very pleased with the experience that they have. In addition, when I'm doing the injections of the local anesthetic along with the twilight anesthesia, I do not use the 2% local anesthesia that Dr. Epstein discusses in his article. The 2% lidocaine is quite a bit. I really use a 1% in just a few areas, but for the most part I use a 2-messin solution, which is a very, very dilute local anesthetic solution. And even with that, really nobody feels what I'm doing during the procedure because it is with IV sedation.